doctor is in. There's been an outbreak of hepatitis A in the Tampa Bay area, which has a lot of people looking for information on prevention and cure. Today, our guest is Dr. David Dean, the founder and medical director of Doctors Urgent Care. Thank you for joining us once again, Dr. Dean.
Thank you for having me.
So, hepatitis A, tell me just what it is so we are all aware of what we're looking at.
Right. Hepatitis A is a virus. Viruses are different than bacteria. They're not treated with antibiotics or treated in other ways. It's an interesting virus that loves the liver.
Okay.
So it gets into your body. There's only one way it gets in your body, and that's through the mouth.
Okay.
So you have to eat something that goes into your gut, and then it works its way into the liver and causes inflammation of the liver. Hepatitis means inflammation of the liver.
Okay, so there's hepatitis A and B and C, and we're specifically talking about A.
Correct.
What are the signs and symptoms if you have hepatitis A?
Right. So it depends on your age. People under 6 years of age, children under 6, commonly have no symptoms, which is strange, right?
Yeah.
So 70 to 80% of them, they just have like a cold, little symptoms, and they get better.
And you would not really know.
And you don't even know they
hepatitis
have
A.
it.
Okay.
And they know that because they've tested them before, and then they had like a cold kind of thing, and they tested them afterwards, and they became immune. Us folks a little bit older than that, so typically teenagers or or older, they have much more systemic symptoms. So it takes anywhere from 1 week to 8 weeks after exposure to start having symptoms.
Wow.
So if you were exposed to someone, you got the infection, the virus brews and grows and spreads until usually around 4 weeks, but anywhere in that period when you start getting sick. The illness is related to liver conditions, so the liver is inflamed. So the liver is part of the digestive system, so you're nauseous, you have fevers, chills, sweats, you get diarrhea. The diarrhea doesn't digest the food well, so it's like a clay color.
Okay.
It's like weird like that. You get abdominal pain. And then very classically, you turn yellow. Yellow is the classic symptom. We call that jaundice.
Yep.
It's a turning of yellow. The eyes turn yellow, under the tongue turns yellow. And then finally, when it's a little bit more advanced, not too much, but a little bit more, then your skin turns yellow too.
Okay, so what is the treatment for that?
The treatment is nothing.
Okay, so it's a virus.
Yeah, so well, some viruses do have medicine. There's no like antibiotic or antiviral treatment for it. If you know you were exposed very early, you can get the vaccine early, or they have an immunoglobulin, which is a shot of the actual antibody that could give you and can get you protected. However, besides that, the treatment they call supportive, which means taking medicine for your fever and drinking lots of liquids and resting and that. Unfortunately, the disease usually lasts around 2 months.
Wow.
It's a pretty bad. You're not just. It's not just a cold. You're pretty sick. A lot of times people are hospitalized. But it can last in 10% of people up to 6 months. So it can last quite a while, and they're pretty sick.
So everything you've said is not something that we want, but then when we hear the news say things like there's a hepatitis A outbreak in Tampa, we get scared. So what are our risks for contracting it?
Right. So the outbreaks and the kind of the fear over that is good for awareness, but the risk of really getting it from that kind of situation is pretty low.
Okay, who are the people most at risk?
Okay, so the risk of getting it from like a restaurant or something like that is just a handful of people compared to the rest. 80% of people that get it in the United States get it are either homeless or use some kind of drugs.
Okay, so not going to a restaurant is not the
prescription
key way.
drugs, but either
Illegal
oral or IV drugs, or are homeless. So 80%. So for whatever reason, that group has less good hygiene and they get exposed to it. The other 20%, a small part of that includes people going to restaurants, but there are other ways too.
Do we know how this outbreak here started? In Tampa.
So the ones in Tampa, the health department has not released significant information of like if a certain person or exactly what happened, but they have been controlled.
Now, there is a vaccine. You said it helps, but who should have the vaccine as a preventative measure?
So there's a vaccine for hepatitis A. It's recommended at 1 year of age to get the first one and a second dose afterwards. So it's a 2-dose series. It's a very safe vaccine. Some people are concerned about live vaccines and other vaccines. This is not a live vaccine. It has almost no side effects. Any vaccine can have side effects, but it's a very safe one. And it is almost 100% protective after 2 vaccines. So if you had it as a child, like my children did, and most children do, you're protected and you have nothing to worry about. You cannot get it.
So that's good to be aware of if you've been vaccinated. Just be aware of the risk, be aware of the signs and symptoms. And as always, let's practice good hygiene wherever we are, right?
Washing your hands, not sharing things with other people, You'd be surprised how many people go to the bathroom, they're on their phone, they come out, they're on their phone,
Yep.
they put their phone down, and even if they wash their hands, hepatitis A is still on that phone.
So taking care of ourselves, but not being too worried, because you guys are always working to make sure that we're staying safe
Right.
with our public health officers. So this is great information. Once again, thank you, Dr. Dean.
Thank you for having
and
me.
Bloom, we'll be right back.
Thank you.
We hope you're enjoying our new show, Bloom. Besides watching us on WTTA Great 38 and WFLA News Channel 8, you can connect with us on social media. Follow us on Facebook at Bloom TV Show, on Instagram at Bloom_TV, or on Twitter at Bloom TV1. We want to know what you're thinking, so again, that's Bloom TV Show on Facebook, Instagram at Bloom_TV, or Twitter at Bloom TV1. We want to hear from you, so log on and tune in to Bloom.
Next, chasing perfection.
Everything in my household must be in order.
Are you living the perfect lie while hiding the messy truth? It is so much about you. It's stunning.
The Mel Robbins Show, today at 1.
Sharoy is facing Sharonda's wrath. She thinks he's sleeping with her best friend.
There's nothing at all going on with me and Sharon.
Nothing.
At all.
What will be uncovered on the next Mars?
Today starting at 4 on Great 38.
When your loved one is injured, you're faced with